Hello everyone, I'm Dr. Emily Carter, and today I want to share information with you that could change the lives of many of you or your loved ones. Have you ever noticed that after taking certain medications, you feel mentally foggy? Or perhaps you've observed that an elderly family member has become increasingly forgetful since starting a new treatment. What I'm going to reveal today is something many doctors don't discuss with their patients, but science has confirmed some medications that millions of people take daily could be silently damaging their memory, especially after the age of 60. This information isn't meant to frighten you, but to empower you. Because when we understand what's happening in our brain, we can make informed decisions that protect our cognitive health in the long term. And believe me, the difference between one medication and another could be the difference between maintaining an agile mind for decades or experiencing accelerated cognitive decline. Let me explain what's happening. In our brain, there's an essential neurotransmitter called acetylcholine. Think of it as the messenger that allows neurons to communicate with each other, facilitating fundamental processes such as memory, learning, attention, and reasoning. It's thanks to acetylcholine that you can remember names, find the right words during a conversation, learn new skills, and keep your mind alert. It is literally the substance that keeps your memory alive. Now imagine you regularly take a medication that blocks this messenger. It literally prevents it from functioning properly. Over time, your neurons begin to weaken, brain connections deteriorate, and that mental fog that you might have attributed simply to age becomes increasingly pronounced. Recent studies have shown that prolonged use of medications with anticholinergic effects can increase the risk of developing Alzheimer's and other forms of dementia by up to 50%. And most concerning is that many older people take several of these medications simultaneously, multiplying the toxic effect on the brain. Let me share the case of Helen, a 72-year-old woman who came to my office accompanied by her daughter. Helen had always been an independent, mentally sharp woman who enjoyed reading and crossword puzzles. However, in the last 2 years, she had experienced a notable decline, forgetting important appointments, repeating the same questions several times in a single conversation, and constantly losing objects around the house. Her daughter was worried, fearing her mother was developing Alzheimer's. When I carefully reviewed Helen's medication, I discovered she was taking 4 medications with anticholinergic effects, an anxiolytic, to help her sleep that her doctor had prescribed after her husband's death, a first-generation antihistamine for her seasonal allergies, a muscle relaxant for her back pain, and a medication to control her overactive bladder. She had been on this combination for more than 3 years, and her brain was being bombarded daily with substances that blocked acetylcholine. We worked on a plan to gradually modify her medication, substituting these drugs with safer alternatives for her cognition. The process was gradual and carefully monitored. And do you know what happened? In just 4 months, Helen experienced a remarkable improvement. Her memory began to recover. She could find words easily again, and she regained the energy and mental clarity that characterized her. What seemed like the onset of dementia was, to a large extent, a side effect of her medication. This is not an isolated case. In my clinical practice, I've seen dozens of elderly patients who have significantly recovered their cognitive abilities by reviewing and modifying their medication. And scientific research supports these observations. Studies conducted at Indiana University, the National Institute on Aging in the United States, and various European research centers have confirmed the relationship between certain medications and cognitive decline in older adults. Now, let's look at the main culprits, those medications that could be silently affecting your memory or that of your loved ones. First, we have benzodiazepines, medications widely used to treat anxiety and insomnia. We're talking about drugs like diazepam, clonazepam, alprazolam, or lorazepam. Millions of people over 60 take them regularly to fall asleep or control anxiety. The problem is that they not only block acetylcholine, but they're also addictive, increase the risk of falls, can cause mental confusion, and accelerate cognitive decline. Research conducted in France and Canada has shown that their use for more than 3 months can double the risk of dementia. Despite this, many doctors continue to prescribe them as a first option, without warning about these long-term risks. The second group of problematic medications are first-generation antihistamines used to treat allergies. Many people consider them harmless, but antihistamines like dexclofenaramine, hydroxyzine, promethazine, or diphenhydramine easily cross the blood-brain barrier and block acetylcholine in the brain. Think about it. You believe you're just treating an allergy or a cold, but you could be paying with your cognition. Most concerning is that many of these medications are available without a prescription, and people take them regularly without knowing their effects on memory, especially at advanced ages. The third group consists of muscle relaxants, like cyclobenzaprine, frequently prescribed for back pain or muscle tension. In older people, these medications not only cause excessive drowsiness, but also confusion and cumulative cognitive deterioration. The temporary relief of muscle pain could be occurring at the cost of progressive memory loss and cognitive abilities. Recent studies suggest there are therapeutic alternatives for muscle pain that don't compromise brain health in the same way. Finally, we have medications for overactive bladder, such as oxybutynin or tolterodine, used to control urinary urgency. These drugs are potent anticholinergics that, while they help with bladder problems, can exact a high price. Mental fog, frequent forgetfulness, and increased risk of dementia with prolonged use. Many elderly people don't connect their memory problems with these medications, attributing them simply to normal aging. The situation becomes particularly alarming when we consider that many older adults take several of these medications simultaneously, which multiplies the total anticholinergic effect. A study published in JAMA Internal Medicine found that people who took anticholinergic medications regularly for more than 3 years had a 54% higher likelihood of developing dementia compared to those who didn't take them. But now for the good news. There are safer alternatives for each of these health problems. You don't have to choose between controlling your symptoms and protecting your brain. For anxiety and insomnia, cognitive behavioral therapy has proven more effective in the long term than benzodiazepines, without the cognitive side effects. Extended-release melatonin, chelated magnesium before bedtime, and sleep hygiene techniques can be excellent natural options. In cases where medication is required, there are antidepressants with a safer profile for cognition that can help with both anxiety and insomnia. For allergies, modern antihistamines like loratadine, cetirizine, or fexofenadine don't cross the blood-brain barrier as easily and have a much lower impact on cognition. For muscle pain, alternatives such as physiotherapy, acupuncture, topical anti-inflammatories, supervised stretching exercises, and local heat application can be very effective without compromising brain health. And for overactive bladder, pelvic floor exercises, dietary changes like reducing caffeine and alcohol, and bladder training can be of great help. When medication is necessary, there are newer options with less anticholinergic effect. Returning to Helen's case today, 2 years after adjusting her medication, She has regained her independence and vitality. She takes care of her grandchildren, has returned to enjoying her crossword puzzles, and travels with her friends. As she told me in her last visit, "Doctor, I thought I was losing my mind, that it was inevitable with age. But it was the medication that was stealing my memories, my personality, my life. Now it's essential that you understand something. Never stop a medication on your own. The discontinuation process must be gradual and supervised by a medical professional. Abrupt interruption of medications like benzodiazepines can cause severe withdrawal symptoms and even seizures. But yes, there are steps you can safely take to protect your brain. First, make a complete list of all the medications you currently take, including over-the-counter ones and supplements. Second, schedule an appointment with your doctor bringing this list and specifically ask, do any of these medications have anticholinergic effects? Are there safer alternatives for my cognition? Third, if your doctor identifies problematic medication, request a plan for gradual reduction and substitution with safer alternatives. Finally, monitor your memory and mental clarity throughout the process, noting the improvements you experience as you make these changes. It's important to highlight that not all doctors are equally informed about the cognitive impact of certain medications. If you feel your concerns aren't being taken seriously, don't hesitate to seek a second opinion, preferably from a geriatrician or a neurologist specializing in cognitive decline. Your brain is your most precious asset. Your memory contains your identity, your experiences, your loves, your wisdom accumulated over decades. You deserve to know if the medications you take to improve your quality of life could be, paradoxically, compromising your long-term brain health. Remember that aging doesn't inevitably mean losing your mental capabilities. Many people maintain brilliant and active minds well into their 80s and 90s. The key is to make informed decisions about all factors that affect brain health, including medication. I invite you to share this video with your loved ones, especially those over 60 or those who care for elderly adults. This information could make a crucial difference in their quality of life. If this content has been useful to you, don't forget to leave your comment, like, and subscribe to our channel for more information that can transform your health and well-being. Remember, knowledge is power, especially when it comes to your health. It's not about rejecting all medication, but about choosing the safest and most appropriate options for each situation. Your brain will thank you, and the quality of your life in the years to come will largely depend on the decisions you make today. I'm Dr. Emily Carter, committed to your overall well-being. Thank you for your attention, and I'll see you in the next video with more information to care for your health in a natural and informed manner.